I'm one of those people that I notice everything that's around me. I notice all the trees and the sky and just how beautiful it is. And I try to teach my grandchildren that. There's such a beauty in a plant that comes from a seed and what it turns out to be. And it takes away all the bad, if there's any bad or anything.
Sharon, she went from this vibrant woman to this lady that was sick and could hardly raise her head up nor even have conversations on the phone. My name is Gretchen McKinney. I'm a nurse case manager. My role is to help follow members once they're out of the hospital and just follow their care until we get them to where they need to be. All of this is done over the telephone, which can be very challenging as we don't see our members.
Over the last 2 years, she just started to get sick and a little sicker and a little sicker, and finally she was diagnosed with the Crohn's disease.
She had had a bowel resection, which is a very common procedure for Crohn's disease, and had a lot of complications.
It just all started going downhill.
I went into renal failure.
It was touch and go there that first couple days.
And in fact, they lost me in surgery, and Dr. Nesbitt brought me back and put me on the ventilator.
Walking into the intensive care and just seeing her on that bed, it was devastating.
10 hospital readmissions in a 2-month period is a lot for anybody. It was incredibly stressful for her and her loved ones.
One day I get this phone call from this woman named Gretchen from our insurance company that says, "I need you to call me."
We went through everything that he might need to think about to be able to help take care of her at home.
What do we need to do next? What do we need to do next to get Sharon better?
We identified devices or supplies that they needed, any type of financial issues that they may have.
She helped us with the home health care. That took a lot off of me, being able to have a nurse come into the home.
We identified dietary changes that was going to be important for her.
She also helped with the insurance forms that I would get.
There was times we talked daily.
She's somebody to talk to and somebody that listened.
He talked with Gretchen and he could cry to her.
Just emotionally, it was the shoulder to lean on and say, "Oh, it's not been a good day today. Here's what happened. Is it going to get better? Yeah, it'll get better. Yeah, trust me, it will." And it did. It did.
I don't think he really could have done it without Gretchen's support.
I followed them for several months after her last hospital admission, and she continued to show improvement. When I started transitioning off of Sharon's case, it was important for me to help her see that during this whole time, when there was times that she probably wanted to give up, that she never did. And I had run across a plaque that said, "Never, ever, ever give up." Because it was so important for me to buy that plaque for them and send it to them.
And my husband and I just cried. We hung the sign on our back door so that every day that we can be reminded of how much Gretchen meant to us during my illness.
We are going to have the opportunity to meet Gretchen face to face tomorrow, and we're really looking forward to this.
To know where she's been and where she's gotten to, I just can't wait to see them. I'm excited to meet them.
I might even give her a ride on my tractor.
There you go. Wow.
How are you? Oh, God. Never thought that this day would come, and it's unbelievable.
It was great. A little emotional, but...
I have been on the way here.
You have. I'm just really, really happy to see her.
You're pretty much back to where you were before.
She's doing wonderful.
She looks wonderful.
Doesn't she?
My goodness. That was my first question. I think our story is remarkable. I think that as I have helped them through her healthcare issues, also they have helped me. I think today I'm a better case manager because of them.
We think about you all the time.
In the beginning, I'm like the average person that, health insurance is, you pay your premiums, but you don't use it because you're healthy. And what am I paying this for? Well, Sharon and I found out what you pay it for.
when I see even Sharon and know that she's where she needs to be and she is back doing the things that bring her joy, I know that I continue to have a passion for this job and want to continue doing what I'm doing.
I'm very satisfied with where my wife is today, and that is
Getting back together.
getting it going again.
Yeah.
And it's been a heck of a journey.